I mean, the traditional way, I'll talk about the traditional bit, and then I'll come on to the green light thing that you've heard about, which is a newer development, if you don't mind. Surgery, if I tell you what it actually involves, first of all, it might make it a little bit clearer.
Yes, I'm not sure if they... What do they do? Yes, please tell me.
Well, normally what would happen is we give you a general anaesthetic, so put you to sleep, and then actually with a camera we actually look down the penis into the actual sort of bladder and prostate area. And to actually reduce the size of it, they cut away at the inside of the prostate, coring it out, almost like coring an apple, if you like. And that's what we'd normally do to actually open up the channel of water so it flows better. Now, what I would expect for most patients is that they'll be in hospital for a number of days, and it wouldn't be unusual to have a catheter for a couple of days after the operation as well. Okay.
Yeah.
Now, I suppose everyone wants to know about sort of drawbacks, side effects, and all the rest.
Well, you hear a lot of stories.
I mean, there certainly are, and I can't lie to you about that. There are always going to be risks and side effects from it. The things that we talk about, well, there are always risks of infections. You've heard about MRSA, obviously, and we obviously do our best in all hospitals nowadays to prevent that, but it is still a risk. We also know that bleeding is a possibility, because any type of surgery, when you're actually operating and cutting the prostate, you can bleed from there. Going on to more specific problems, you've already mentioned really about sort of incontinence and impotence as well, erection problems, and there is a risk of that. They're fairly small risks. I mean, the actual numbers, if you want me to tell you what sort of is quoted, for the actual impotence side, they quote between 1 in 10 and 1 in 20 gentlemen. So it's not a completely tiny risk, but it is there. And I know already, obviously, that you're on medication that you use time to time for erection problems, which may or may not help in the situation if it did get worse.
I see, yes.
Okay. And the other one that a lot of chaps are very fearful of as well is incontinence, or losing control of your bladder.
Yeah, so you have to wear a catheter for the rest of your life.
Yeah, and that's the one that a lot of chaps don't like the sound of at all, quite understandably.
Yeah.
The actual sort of rates they quote for that, for the type of operation we're talking, is about 1 in 100. Which, you can think of it the other way, of course, which is 99 out of 100 don't have a problem.
Yes.
But there is still that risk. We have to obviously mention these and explain them to you.
Certainly a more acceptable risk than 1 in 15, I think.
Yeah.
Right. And would, if we were to go down the line of surgery, would that remove the symptoms?
I would be very hopeful that it would.
Yeah.
But of course, I can't promise that.
I understand, you can't.
And there is always a sort of what we call a fail rate, or a chance that it won't make a difference.
Yes.
And in addition to that, some people do get better, but then later on, years down the line, need to have something similar done again. So there's always that possibility. And again, that's because the prostate grows, and it continues to grow. So the symptoms can come back.
Yes. But presumably, it would take a bit longer than if you hadn't had the operation.
Indeed,
Yeah.
indeed. I mean, if I move on, unless you've got any specific questions so far on that, if I just mention the green light.
Yes, that's right, yes.
This is a newer development. It's a relatively new treatment compared to the old style way of doing things. And the actual procedure initially is very similar. They put you to sleep with an anaesthetic. They use a camera to look into the bladder. But instead of actually scraping out the inside of the prostate, they use a laser to burn it away. The initial reports on what we're getting through about it is that it does seem to be very well tolerated, and people seem to get on very well with it because they seem not to bleed as much. They also seem less likely to need a catheter straight after the operation, or if they do have one, they have it for less time. And because of that, people end up getting home a bit quicker as well.
Yes. And what about the impotence?
There seem to be, the quoted figures we're getting are that there's lower rates of those problems, lower risks. But, as I said, it's a relatively new procedure, so the actual amount of information we have, the amount of cases done, is not as big as the other stuff.
I understand, yes.
So I can't say in years to come that there might be a slightly different view on it.
And they might discover some long-term side effect of it.
It's always possible, always possible.
Right.
What do you think so far about the sort of surgical side of things?
Well, I'm going to have to think about it, and I'm going to have to talk it over with my partner. Because obviously, the risks are, in terms of odds, small, but in terms of effect, considerable. And so one has to balance that with waking up 3 times, feeling tired, and so on.
Well, could I suggest also the one thing that I would maybe do is give you some more information about the actual operations. I've got some written information for you to take home and have a read. And maybe you can have a look with your partner as well, he can look through with you. But the actual sort of procedure, the In the meantime, it might not be a bad idea to try cutting down the alcohol
I should do
and
that.
the caffeine,
Yes.
and it gives us a bit of a chance to see if that helps.
Yes.
I've known gentlemen. Oh, sorry, you
Well, I would say that would be the best answer. I'd happily forego my late night coffee and drink a lot less to avoid these symptoms, certainly.
Well, I've certainly had chaps who've done exactly that, and they've managed to avoid surgery for another few years.
Yeah.
So that would be an option, and I would suggest trying that anyway.
I will try. Yes, certainly I will, yes.